Hello, everyone. Our today's topic is cholecystitis. We are going to cover first aid page number 390. That tells us about cholecystitis. The things that you noticed in this presentation written in blue are mostly my URL notes. So what is cholecystitis? It is acute or chronic inflammation of the gallbladder. Acute cholecystitis is caused by gallstone obstruction in more than 90% of cases. So this is the most common cause of cholecystitis. Biliary colic. Biliary colic is associated with nausea, vomiting, and dull right upper quadrant pain. So if you notice a patient came to you with right upper quadrant pain, having vomiting, then you can relate this to biliary colic. Those who have cholelithiasis, what happens when they intake food, fatty food, it stimulates contraction of the gallbladder against the impacted stone, resulting in severe colicky pain. Neurohormonal activation by CCK after a fatty meal triggers contraction of the gallbladder, forcing stone into the cystic duct. Ultrasound shows cholelithiasis. If we zoom in here in the picture and imagine there are stones in the gallbladder, after fatty food ingestion, what happens? CCK release from the duodenum and it causes contraction of the gallbladder. With the gallbladder contraction, the stone moves towards the cystic duct and causes the blockage here. This is what is described in this slide. Then calculus cholecystitis. This is exactly what we're talking about. This is the most common type, is due to gallstone infection in the cystic duct, resulting in inflammation and gallbladder wall thickening, and it can produce a secondary infection. So what's going on? That gallbladder infection is causing, gallbladder infection in the cystic duct, what it is causing? It is causing colicky pain. Why it's causing colicky pain? Because gallbladder has bile in there and there is having a biliary stasis in there. It doesn't have any room to go out. It is stuck there, which is causing inflammation of the gallbladder. The gallbladder inflammation cause mechanical disruption of the gallbladder mucosa and release of inflammatory mediators, for example, prostaglandins and lysolecithin, which cause the obstructed gallbladder to be inflamed and edematous. As the blood supply to the distended organ becomes compromised, secondary bacterial infection frequently develop. Due to that inflammation, obviously there will be hypoperfusion, which leads to secondary bacterial infection. What are the potential complications? Complications include gangrene and perforation, with subsequent formation of a pericholecystic abscesses or generalized peritonitis. As I mentioned, there are two types of cholecystitis. It could be calculus cholecystitis, which is most common, and the other type is acalculous cholecystitis. This is also due to gallbladder stasis. There will be hypoperfusion. It can be seen in critically ill patients with the infection like cytomegalovirus. You may have heard about Murphy's sign. What exactly it is? When you ask a patient to exhale, an examiner places his hand below costal margin on the right side at the midclavicular line. The patient is instructed to inspire. There you will notice inspiratory arrest on right upper quadrant palpation due to pain. Pain may radiate to the right shoulder. This is the Murphy's sign. Why pain is radiating to the right shoulder in this situation? This is due to irritation of phrenic nerve. Since diaphragm and right shoulder share same nerve supply, that is phrenic nerve, that is causing pain radiation to the right shoulder. Labs will be like increased alkaline phosphatase if the bile duct becomes involved, for example, ascending cholangitis. But we cannot diagnose cholecystitis with the raised ALP because it is raised usually in liver and bile duct abnormalities if there is any inflammation in liver or in bile duct. But we can definitely diagnose with ultrasound or cholescintigraphy, HID. Failure to visualize gallbladder on HDA scan suggests obstruction. So what will be seen in the HIDA scan? You will see no gallbladder. This is the diagnostic tool. Acute cholecystitis, acute cholecystitis ultrasound findings are gallbladder wall thickening, pericholecystic fluid, positive sonographic monographic Murphy's sign. Now, what is cholescintigraphy? Cholescintigraphy is a nuclear medicine hepatobiliary scanning. What's going on in the cholescintigraphy? In normal individual, when an individual is intravenously injected with the radiotracer, which is taken up by hepatocytes and excreted into the bile, after several hours of injections, images are taken. In the normal individual, you are able to see gallbladder. But if there is an abnormality and there is some obstruction right there, then the dye cannot enter into the gallbladder, and you cannot see gallbladder in this image. Let me show you a patient who had fatty meal. At 55 minutes, the gallbladder demonstrates further contraction, as you can see here. You cannot notice gallbladder here, even though you can see biliary ducts right there, but no gallbladder because there is obstruction right there. This is what cholescintigraphy is. Now we are ready for the question for the day to test our knowledge. So 50-year-old woman present with sharp sudden colicky pain in the upper abdomen, along with several vomiting episodes. That means patient is having colicky pain, several abdominal pain episodes in the past which resolved spontaneously without treatment. History of complicated appendicitis when she was 22 years old. Temperature is 100 Fahrenheit, pulse is 112 per minute. Cessation of inspiration with the palpation of right upper quadrant. What is that? Is Murphy's sign. Serum bilirubin is 0.8 mg per deciliter. Alkaline phosphatase is 100 unit per liter. Which of the following diagnostic tests would be the most specific to acute cholecystitis? So what are the options? Distended duodenum on upper GI series. Do you think that could be the cause? Or we can diagnose with the distended duodenum? The question asking about the diagnostic test. No, we cannot diagnose cholecystitis with a distended duodenum. It means that if there is a distended duodenum, it means that there is some small bowel obstruction. It is not related to cholecystitis at all. Option B, opacities in the right subcostal area on abdominal X-ray. Usually gallstones doesn't have that much calcium that they can be seen by X-ray. So therefore, X-ray is not the diagnostic test for gallstones. Increased serum AST and ALT. Serum AST and ALT elevated does show that there is some problem in the liver, but it is not diagnostic criteria for cholecystitis. Echogenic structures inside the gallbladder on abdominal ultrasound. Echogenic structures could be either gallstones or could be gallbladder polyp inside the gallbladder. But the question is, what is the diagnostic test would be most specific to acute cholecystitis? So this is not the answer. Which diagnostic test? Option E says failed gallbladder visualization on radionuclide biliary scan. That's the right answer. This is what we look for in cholescintigraphy if we are unable to find find out the gallbladder. That's it for today's lecture. If you guys have any question, so then please you can put them in comment section. I will respond to you right there. And please make sure to subscribe to my channel so I can continue making videos for you. Have a nice day.